Delon is here today for the Femlift laser treatment for incontinence and vaginal tightening.
I had my daughter 11 years ago, and I delivered her vaginally. I started noticing during running or jumping around, I'd have a little leakage. It was like, uh-oh, I think I peed on myself. I have to wear panty layers. It's like, I already had to prepare the baby. Now it's like, I gotta prepare my own diaper bag before I leave. After I deliver my baby, it's like, okay, is it a little too loose? How do I get it to go back? What do I do here? Is it supposed to be like a rubber band? No, I guess it's not.
Delon has had one treatment, and she's here for her second treatment today. The Femlift procedure is perfect for her because it helps to tighten and resurface the vaginal lining and also helps to support the urethra. It's painless and it's fast. How have you been feeling?
I've noticed less of the urination coming out, so that's a good thing.
So when you're running, jumping, exercising, not leaking?
Not leaking, no.
I'm going to insert the probe. We're going to go in a circumferential fashion, all the walls of your vaginal opening. This is the actual laser that comes out of there. Okay, here we go. 1, 2. So what the laser does is help to increase blood flow and change the nature of the collagen in the wall of the vagina. You did great. I expect to see continuation of her improvement in continence, as well as improved vaginal sensation, vaginal lubrication, vaginal tightening, and pleasure during sex.
Please welcome Delon, who just had your second procedure recently. Have you noticed any changes?
Oh my God, yes.
Procedure?
Now that I've done my second procedure, I have definitely noticed a difference. I don't have any leakage anymore. I don't have this frantic, let me get to the door.
So right. She's saying something really important. There's a difference between stress incontinence, which is leakage when you cough, laugh, sneeze, jump, run, or urge incontinence, which is when you get the urge, urine just leaks out. There are two different kinds, and this procedure actually helped her urgency as well as her stress incontinence. But what this procedure is that's so great about it, especially for a young woman, is it's minimally invasive, painless. Inside the vagina really does not have sensation. It doesn't feel. It feels pressure and it feels stretch. The outer side, towards the opening, has normal sensation like skin. But that's why we're able to do this without anesthesia, which was so great.
So then, with something like this, how many treatments will she have to have? And so after the treatment, can she go back to normal intercourse, or is there a waiting period?
It's 4 days without sexual activity, as opposed to 4 to 6 weeks, which is the normal course after a surgical procedure.
Because incontinence is so common, I'm just curious, is this type of procedure now widely adopted across the country?
It hasn't been yet. I'm hoping so. As a urologist, and I fellowship trained in female urology and pelvic floor reconstructive surgery, our standard of care for refractory stress incontinence that was not amenable to Kegels or other things was surgery. So this is, to me, a groundbreaking new intervention. And it's not only mild stress incontinence. Hers was mild, but moderate.
Lasers are so remarkable.
Fabulous.
They are.
Delon, thank you for sharing this story.